Basically, what we want to be able to demonstrate to you, one is how to be able to identify a child who has a tension pneumothorax and what are the probable signs that you need to, that will tell you the child has a tension pneumothorax and what to do about it in an emergency setup, assuming that you're the only service provider or the healthcare worker, at least in that setting. Okay?
Okay.
Yeah, so first thing that you'll notice, especially for a child who has a tension pneumo, is that they will have difficulties in breathing, okay? So you might notice that they're either very tachypnic, so they're breathing very fast, or in some cases, it might be actually a child who is maybe on a ventilator, is being ventilated or is being bagged, okay? So the other key sign is that the oxygen saturations, when you attach the monitor, they will have dropped, okay? So they tend to have very low oxygen sats. You may also notice like their blood pressure has dropped and they're extremely tachycardic, so you have an increasing heart rate, okay? So those will be the general signs. Now, what are the actual signs that you look for on the chest? So the first thing you want to do is feel for the trachea. So you put your fingers around the trachea. So you basically go for the sternal notch and put your fingers there. You can even demonstrate it on yourself, where you actually feel your trachea with your two fingers there. Okay? So you feel there. And the trachea will be deviated away from the side where the tension pneumothorax is.
Yes.
Okay, so it will be deviated. That's the first thing. And the second thing, maybe I'll ask you to bag the child.
Okay.
Okay.
So I'll put my child with us in a sleeping position.
Yes. Okay, so you're bagging the child, and you'll notice that the chest movement is only on one side. So in this case, you can see the chest movement only on the left. Yes, on the left side of the child.
Yes.
The right side, you can't see any chest movement. Okay. So you'll notice that, and you can percuss. Okay. So you feel hyperresonance. There, you feel normal resonance. Okay. So normal resonance, hyperresonance, normal resonance during percussion. Okay.
So
and you continue bagging. One more thing that you'll also do is that you listen for breath sounds. So you hear reduced breath sounds, normal breath sounds, okay? Or you can hear good air entry on that side, reduced air entry, and normal air entry on that side. Okay? So all those signs point towards possibility of a tension pneumothorax, likely on this side.
On the right side.
Okay? And it's tension meaning that there is air which is getting into the pleural cavity on this side, okay, and is causing a lot of tension on that side and pushing the mediastinum and the lungs on the right, on the left side, to the left side. So what are you supposed to do in those circumstances? As an immediate emergency, identify, okay, your sternal notch, okay, which you can feel there, and then palpate down, okay, the sternum, and feel for what you call the sternomanubrium junction. Okay, once you can feel the sternomanubrium junction, now move to the side with the tension pneumothorax, and you will feel a space. So that's the second intercostal space that you can feel. Okay, so go all the way to where the mid-clavicular line is likely to be. So maybe just around the area of the nipple. Okay, get your needle. So I'd suggest that you use just a normal cannula. Okay, so the widest bore cannula that you can get. Okay, remove the guard, okay, and then feel again sternomanubrial junction, second intercostal space, mid-clavicular line, and go in with your needle, perpendicular, okay, and as you go in, okay, having removed, of course, the cork, okay, and as you go in, you should be able to hear a hissing sound, okay, as the air that was trapped inside the pleural cavity comes out, okay? And when you do that, remove your needle, okay? So remove your needle and leave the plastic cannula in place, okay? So it remains in place and to allow, if there's any trapped air, to continue to gush out, okay, from that chest. So remember, this is an emergency maneuver, and you still have to be able to get the surgeons or the expert in your institution to come in and put a definitive chest tube.
Okay.
Okay, so we're clear about that?
Yes, I'm clear.
Okay, so
yes.
thank you very much.
Thank you.
All right.
Okay.